Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. And today's program is geared towards those of us that are on Medicare. Medicare has changes, and every couple years on this program, we've approached the changes and the new directions that Medicare is heading. And to do this, we ask Kevin Waltko of Medicare 360 to come and give us a perspective on the future of Medicare and how it affects our lives. Because it's a little bit different for some of the things up here in the mountain. So I'm going to say welcome, Kevin.
Thank you for having me on, Dr. Barela.
I'm always happy to help you on because I think most people don't realize how important it is to make choices in Medicare that are directly related to their own care. I think it's really, really important that people understand that it's not a simple thing that they can just go to the internet for. At least it hasn't been for me.
Right. Well, Medicare.gov has made that a little bit easier through the last couple of years. However, there are plenty of situations out there where the websites or internet does not help us out. So that's where conversations with people who know what they're discussing can help out.
And you're essentially a professional advisor for people on Medicare, even though the name of your group is Medcare, not Medicare.
Right. Well, by law, according to Center for Medicare and Medicaid Services, companies are not allowed to use the word Medicare in their business name.
So I see.
Following CMS guidelines.
Okay, so I know there are changes coming up because we've talked about it before the program today, and there's a big change coming up next year called MACRA.
That's right.
It has an acronym for some long thing probably from the government.
Sure, the Medicare Access and CHIP Reauthorization Act of 2015. Sure.
Okay, and what is it?
Well, how it directly impacts our Medicare beneficiaries across the country is the first thing that we have seen is the Medicare A and B card that now has an alphanumeric number. It is the number that is no longer associated with your Social Security for privacy.
And I know you have a copy of the new Medicare card up there
Right.
on the screen.
Right.
And so this complicated 1EG4 is the new Medicare number?
Correct.
No more Social Security numbers?
No, and if we have people out there that are watching or know of people that have not received their Medicare card yet, or their new Medicare card rather, you're going to want to contact Social Security because those have all been completely sent out across the nation.
Okay, and we're taping this at the end of September 2019, which means that if you haven't gotten your new Medicare card,
go to Social Security.
Go to Social Security and get it?
Right.
Okay. So that's an important piece of information for everybody to understand. Is there anything else about this particular card other than the number that's different?
No, it just simply changed the alphanumeric number from Social Security. Your Part A benefit active date, and then the Part B active date is also on that card, as it was always.
Okay, so what is Part A and Part B then?
Medicare Part A is our hospitalization coverage. Original Medicare is a $1,364 deductible per hospital stay. There is no cost for Medicare Part A because most likely people worked for 10 years or 40 quarters in the United States. So Part B is our medical coverage or our outpatient services. That does have a $135.50 monthly premium, and with a $185 deductible one time at the beginning of the year. Then after that deductible's met for our outpatient services, we then pay 20% for all of our medical coverage.
Okay, so that's important. So Part A is for the hospital with about $1,300 deductible?
Right.
And then you're responsible for everything, and then they pay for everything.
No maximum out-of-pocket limit. We were actually doing a certification here recently at the office, and it was an interesting statistic. One that really surprised me was that people in the nation who remain on original Medicare with no secondary insurance, 47% file for bankruptcy across the country. That was a staggering. I had no idea. I didn't either. Staggering statistic.
So
I would have said 10.
Older
maybe.
people that, well, Medicare age people that don't take some of the additional choices that are available to
Whether
them.
it be an Advantage plan or a supplement.
Okay, so that's important to understand. A covers hospitalization, $1,300 deductible, and then 20% above that?
No, Part A does not have 20%. It's just
Okay.
a $1,364 deductible per hospital stay.
Okay.
So
All right.
that's why people would elect to go on a Medicare Advantage plan or a supplement to curb those deductibles.
Okay, so, and then Part B is for all the outpatient stuff we do, basically.
Correct.
Going to the doctor, x-rays, lab stuff and stuff.
Correct.
And we pay $135 a month for that?
$135.50 this year. We'll see what the numbers shake out to for next year as far as deductibles. Those numbers are usually released early to mid-December. So we'll just have to keep an eye on what those deductibles and premiums are going to for 2020.
All right, so frequently we don't know that number until after we sign up for everything in October and November and early December.
Unfortunately, yes.
Okay, so that's two parts of Medicare, and we're going to talk a lot more depth about that. And then there's Part C and Part D.
Part C and Part D, yes. So we have Medicare Advantage. Like our HMOs, PPOs here in Navajo County, we have a private fee-for-service, which is actually fortunate for us because there's no network of doctors like you would experience with an HMO. So you can go to any doctor that accepts the plan's terms and conditions. Unfortunately, here in Navajo County, we are limited to Medicare Advantage programs. A lot of our viewers may be receiving a lot of literature in the mail right now for plans that aren't even available in our county. Some of these plan sponsors that service Maricopa County or Pima County will send out mailers to the entire state. So what we will see during the annual enrollment period is people coming up with a flyer in their hand for a plan that's not even available. So unfortunately, it's very difficult to control where plan sponsors will send out their mailers.
All right, so we have to be. So essentially Part C is like a health insurance plan?
It's a Medicare Advantage plan. It will replace your Medicare A and B. You have to have A and B to get Medicare Part C.
Okay.
Okay. And as long as you live in the plan service area, you can enroll into any Medicare Advantage plan that's available in, say, Navajo County.
Do you have to pay extra to get
Yes,
C?
in Navajo County, many plans have a monthly premium. There is only 2 plans that do not have a monthly premium.
So in addition to the $135,
Correct.
you have to pay a Medicare Advantage plan.
Correct.
And the Medicare Advantage plan essentially limits who you can go see?
Yes,
to
because the
people
doctor
locally?
has the right to accept or deny the Medicare Advantage program. So that's where the Medicare supplements come into play because they offer a lot more flexibility for the beneficiary
Okay.
to go see who they choose.
And I think that's an important distinction for our viewers to know, is that a Medicare Advantage plan, if I'm hearing you correctly, defines the network that you can use, and up here our network is narrow. So what happens if you join a Medicare Advantage plan, let's say, that covers most of the doctors in our particular area on the mountain, and then you need a specialist in the valley?
Then you'll have to reach out to that specialist and see. The Medicare Advantage plans do not require a referral here in Navajo County. So you can, what we refer to as self-refer. You'll have to reach out to that specialist in the valley and probably send him a copy of your card to see if he will accept that plan. And that is very important that you do that, because one thing that you do not want to do is go see a specialist down in the valley and then later on find out that he's not going to accept your insurance, leaving you with the entire bill.
And the term for that is accepting Medicare assignment?
Through original Medicare, yes. With the Medicare Advantage plans in general, physicians will be contracted with that Medicare Advantage plan sponsor. Okay, so just because a doctor accepts original Medicare fee-for-service does not mean that he's going to accept that Medicare Advantage plan that you may or may be on.
It's an important distinction, because you know, there's a lot of stuff on the news about people getting balanced billing and end up with these huge bills that they didn't anticipate, and issues about going to hospitals and finding their radiologist or their emergency room physician is not contracted with their plan, while the hospital may be contracted with the plan.
That is correct.
Okay, so that, and then there's an alternative to the Medicare Advantage plans, I know, and you want to, and you're going to talk about that. Maybe that this is the time to maybe talk about that. I know there's one other section of Medicare, Part D, that is also an incredibly important plan for many people to consider.
It is probably one of the most important parts of Medicare because it's utilized monthly for people who are taking maintenance medications. One thing to understand is that Medicare Part D plan sponsors will change their monthly premiums, their deductibles, their formularies, or the medications that are covered under that Part D prescription plan. So it's very, very important to reshop your Part D prescription plan each and every year to make sure that whenever you go in to pick up your medications, say next January or February, and you find out that your medication is no longer covered or that is a much higher copay than what you were used to last year.
Okay, and this, I know that in your office you ask people to bring their medication list to you so that you can go to the Medicare website and essentially look at the best deal for your particular set of medications.
Sure. We sit with a lot of clients each and every year, say a husband and wife, for instance, who may be taking different maintenance medications. We have a wife that may be on a cholesterol medication only, and then a husband that may be on a couple of different types of medications, and they may not be on the same Part D prescription plan. I may have one spouse with one company and another spouse with another company because it's solely based on what type of medications you're currently taking and where you like to get those medications at the pharmacy.
That's really important. So, and especially for the tiers 3, 4, and 5 drugs,
right,
which are the expensive drugs that sometimes require pre-authorization on one plan and maybe not pre-authorization on another plan?
Right. A very common situation is where we will see where a plan sponsor or a Part D prescription plan may move a particular prescription from a Tier 2 medication to a Tier 3 medication. When we do that, it moves it into a name brand medication, and now we have a deductible that will apply. This year the deductible is $415 for most plans. Next year that deductible is going up. Okay, so we need to understand that the deductibles are going up, and we need to make sure that if we are taking some Tier 2s, ensure that they're not being moved to Tier 3 levels to where the deductible would apply.
Apply to that.
Sure.
And it's Part D that is also related to the donut hole, is it not?
That's correct. You know, a lot of the medications that'll drive us.
I hear your sound because nobody likes to hear about the donut hole.
That's correct.
But I understand it's changing next year too.
Well, it's increasing as well. So the dollar amounts are going up to where you would have to reach that donut hole or the coverage gap to what it is formally called. Some of the medications that really drive us into that donut hole is COPD medications, insulins for diabetes. Those are some of our tragic medications that a lot of our residents are experiencing high copays on.
And unfortunately, those two illnesses are very, very frequent. And so I think it's important, before we go on to the actual health plans, that people understand that, at least I'm understanding what you're saying, is that people need to be careful on their Part D drug plan. So I guess my next question for you is how easy is it to change Part D drug plans every year?
It's very simple. It's very simple. During the annual enrollment period, October 15th through December 7th, you can change your Part D plan as many times as you like. At midnight on December 7th, whatever you have chosen last will be your Part D plan for 2020.
Okay, so there's some homework to be done for those of us that take medications as elderly people. Number one, to protect ourselves from the donut hole, but to understand that some of our drugs are covered differently from different health plans.
That is correct.
So how many Part D plans do we have up here?
Well, there's Part D prescription plans are statewide.
Oh, so
okay, so Part C Medicare Advantage plans are countywide. Part D plans are statewide, so no matter where you live in the state of Arizona, you can choose one of 28 Part D prescription plans this year.
Okay, so there's lots of choices.
There's lots of choices.
And that means that people like you are real important because I get to choose 1 to 28.
That's for sure.
Okay.
So,
all right. Well, let's. I just want to make sure our viewers understand that Part D is something that really can make a difference for your monthly pocketbook, even if you're not hospitalized.
that's correct.
Okay.
Well, if you're hospitalized, all your Medicare Part D prescriptions fall under Medicare Part A while in the hospital.
While in the hospital.
Yes.
That's good because my $50 a pill medicines in the hospital would be, where I pay $4 for 3 months of the medication, costs me $50 for one in the hospital.
Right.
But we won't talk about that during this conversation. So, we kind of touched on Part C because as really a subset of Part D or Part B. Remember, Part B is the outpatient plan. Remember, you're the one that knows it. The Part B is the outpatient plan, and C is one way to cover the costs of Part B. Is that not right?
Right. So the rule with Medicare Part C or Advantage is that it has to be at least equal to A and B. It cannot be less than.
Okay. So let's go, since we live in kind of a rural community and we're up on the mountains, let's talk about other options other than a Medicare Advantage plan. And I know that's a big piece of what our viewers need to consider every year. Where they get their day-to-day medical coverage. So What's else is out there besides the Medicare Advantage plan to cover A and B in a more extensive way?
Because of the lack of choices that we have here in Navajo County, and particularly in Apache County, has even less than Navajo, supplemental insurance becomes increasingly more popular. Medicare Supplements Plans A through Plan N offers a wide variety of different types of coverage. We do have a slide up here. Just one thing to touch on, maybe go back to MACRA for a moment, is that the two supplements that will be exiting starting January 1st of 2020 is the Medicare Supplement Plan F and the Medicare Supplement Plan C. The reason why is because those are two Medicare supplements that offer first dollar coverage to where they cover your Medicare Part B deductible. Okay, now for beneficiaries who are already on Medicare or starting their Medicare in these last few months of 2019 can choose the Plan F or the Plan C and continue to choose the Plan F and Plan C even down the road in 2020 or 2021. So that is not going away. When Plan F and C goes away, that is for people who are aging into Medicare starting in January of 2020. Those plans will not be available to them. So the only new plan that will be added to the MACRA Medicare supplements will be the Plan G high deductible. Okay, so that'll be something.
Can you go through this alphabet soup here?
Well, the most popular Medicare supplement out there is the Medicare Supplement Plan F because it covers 100% of all of our Medicare benefits. Okay, so if I have a Medicare Supplement Plan F, I have no copays, I have no deductibles. Okay. But what's going to happen here in the very near future is that the actuaries at insurance companies are starting to figure out that they would like to have it more affordable for people across the country to select a Plan G over the Plan F. So insurance companies are encouraging people to go with the Plan Gs from an affordability standpoint because the Plan F is increasingly raising their rates.
So the different sections of the coverages, I noticed that some are 100%, and essentially, is it Plan F where everything's 100%?
Everything's 100% with Plan F. So if you have a Plan F currently now, you're happy with your Plan F, you can remain on it as long as it's affordable for you, right?
So the way they get you out of it is by raising...
Well, back in 2009, there was a Medicare supplement plans H, I, and J. J was actually more benefit-rich than Plan F. What happened in 2010, because this is the Modernized Medicare Supplement Act of 2010, is people who had a Plan J were told that they could keep it, but the insurance companies started raising the rates to the point to where it became unaffordable for most beneficiaries, so the insurance companies made them guaranteed to issue to move from a Plan J to a Plan F. They are not doing this time, which tells us that they are going to try to sustain the rates to a certain level with the Plan F because they are not making a guaranteed issue to go to a Plan G automatically.
Wow.
So you will have to qualify in the future if you want to move from an F to an F or an F to a G.
Wow. Okay, so G is so when you go through this alphabet soup, really there's only one choice now, or going to be only one choice, and that's a G in the future?
No. We'll still have Medicare supplements plans A, B, D, G, K, L, M, N. So whenever we show the chart here on the slides, you can see how they are all different, but there will be no Medicare supplements in the future for people aging into Medicare that'll offer first dollar coverage, because Plan G will be the most benefit-rich plan.
And so what is your, if there's not first dollar coverage, what is going to be your out-of-pocket cost?
Well, it'll be the Medicare Part B deductible, which this year is $185. And then at the end of December, we'll see what that deductible moves to. Okay. It's also important to understand that with that Part B deductible, if you do have a Medicare supplement, the Medicare supplement will automatically adjust to the new deductibles.
Okay, all right. So what about the Medicare Part A deductible?
Yes, it will adjust to the Medicare Part A deductible as well.
So with G, you're still going to have to pay the $1,300 deductible for hospitalizations?
No, all Medicare supplements cover the Medicare Part A coinsurance and hospital costs.
All right, so really the only issue is the Part B piece of it.
That is the biggest.
That is the biggest piece for supplements.
Right.
Okay, so most of us then are going to be going towards a G plan.
Eventually.
Once
the Plan F becomes unaffordable, it's very important for people to reshop their Medicare supplements as well, because most insurers only guarantee that rate for 1 year, and then they will start raising the rate.
Right.
So, I speak with a lot of people in my day that feel that they have got the best Medicare supplement. Well, in reality, if you have a Medicare supplement Plan F, they are all federally regulated, meaning they all have to cover you the same. So, my suggestion is do not become complacent. Once you feel that your Medicare supplement is becoming unaffordable based on what your income is, go shopping. Look for that Medicare supplement that'll still give you good coverage, yet save you money at the same time.
So, in your experience, what is the distribution of people that choose different plans? I mean, do 90% choose an F or a G, or do 50% choose an A, or
most people choose the Medicare supplement Plan F and Plan G because of the security, because of the benefits that are involved with those two plans. As far as what people are choosing across the country, Medicare Advantage is becoming more increasingly popular across the country. However, us here in Navajo County are still faced with the same reality that the Advantage plans just are not coming to the rural areas. They're really in Maricopa and Pima counties, where the population of our state is.
Yeah,
so it's really unfortunate.
Yeah, it is unfortunate, and unfortunately for people that have summer homes up here, they may have a Medicare Advantage plan that covers them in Maricopa or Pima County, but the doctors up here aren't on that particular Medicare Advantage plan. True.
So those people that are in that situation are restricted to going to the emergency room because their Medicare Advantage plan covers them worldwide with Advantage.
Okay. So give me an idea of the cost of Medicare supplements, F and G, because...
Turning 65 female, $120 for a Plan F, $100 for a Plan G. $80 for a Plan N.
But Plan N is not as comprehensive as...
No, the Plan N really, the benefit that I like is Medicare Part B excess charges. And what that means to us is that we may go see a provider that will accept Medicare, but they may not accept Medicare assignment. So with the Plan N, you actually lose that Part excess benefit.
That's an important...
So that leaves us responsible for the 15%.
Yeah. And that's significant. Okay, so I want to talk about one thing, about how easy is it to change Medicare supplement plans?
Well, once you're past your Part B effective date for 6 months, you then have to answer 14 health compounded questions. Pretty serious questions.
Mean whether you're sick or not?
If I have diabetes, that's okay. If I'm taking metformin, that's okay. But when I start going on insulins, depending on how many units of insulin I may be taking that day, will depend on what companies will accept me.
So it's really important, what I'm hearing you, is that when you turn 65, to pick a good plan?
You want to pick a good Medicare supplement, a reputable company. There are a lot of companies coming into the state of Arizona right now, some young companies that also actually have a very good rating with Standard & Poor's and AM Best. Companies as young as 2 years with a very stable outlook. So the Medicare landscape across the country is getting very competitive because of the baby boomers that are aging in right now.
Oh, okay. But I mean, I guess my point is that I'm not sure what my point is. The concern is that if you have a pre-existing condition, you have serious illness, you have limited flexibility to change down the road.
That's right. Some of our more affordable Medicare supplements are also the most stringent for health underwriting. So, but there are some Medicare supplements that are available across the country that are more lenient with their underwriting.
So let's say we all have to go with a G. Now there's a spread in the monthly cost for G among the different healthcare providers.
You can get a Plan G for $100 a month. You can get a Plan G for $300 a month, and everywhere in between.
So how do you choose?
Well, we go to a calculator. We use calculators at the office for everything because it allows everyone to see exactly what plans are available to them. So at our office we use a television set, and we put our computer on a television set, and we show everybody exactly what we're doing, and we help them, make a good, intelligent decision on what plan they think would be good for them in the future.
So part of the system is rating the quality of the insurance company behind the supplement.
Right. The calculators all show their AM Best and their S&P ratings, how long they've been doing Medicare supplements, how good are they.
Okay, so an average price for a supplement would be
$100.
Let's say
$120.
$120.
If I'm an unhealthy individual and I can't health qualify for an affordable one, I have to pay a higher rate because of maybe certain health conditions.
We're almost out of time, Kevin. So I calculate a supplement $120 a month, Medicare itself $185 a month, and then an average cost maybe for a Part D plan?
$20, so we're pushing about $300 a month in total.
And some supplement plans are up around $80 a month. Not supplement plans, but drug plans.
Yes, so some of those Part D prescription plans are geared towards people who may be taking insulin, for instance, where they'll offer a lower, maybe an insulin will be a tier 2, keeping them out of that deductible situation.
Okay. Well, I thank you. It's always good to hear from you because it's incredibly complicated. And as we close the program today, all I can say to those of us that are Medicare age is that it's more complicated than going to the internet to look and see or to read the advertisement. Kevin, of course, is one of the professionals up here that deals with Medicare choices. There are other ones up here on the mountain. And I would encourage you to think carefully about your choices. And the best thing to do, of course, is stay healthy. And I thank you for watching today.